And the gang is back. So testing, we are talking about testing, mass testing, targeted mass testing, Jamila. So far, 36,918.
Yeah.
Against a target that, if we were really to think about it, we probably should be ranging in the regions of 100 and something thousand if we were to meet the target of 250,000. But here we are, 36,918. We tested in the last 24 hours, 1,486. That actually one of the better days, because there are times when we do 600, 500. And that has been our story. Of course, there is the whole thing of reagents and all kinds of things going on there. But this mass testing, mass targeted testing is so critical, because it's almost as if the more we test, the more that will turn out positive.
Exactly. This is an example even Gashuri always gives. And the reason why we had higher numbers in Isili and Old Town was because we were testing more people in those areas. And Kawangware, the people are going, the tests were actually taken to the estates and the areas for people to be tested, and that's why we had higher numbers. In fact, the argument is, even if you took the same machines to Dandora, you may have higher numbers. If you took them to another estate in Mombasa, chances are you'll have it that way. And then, but now this issue of kits and reagents and whether we have enough of them or we don't still also comes up, Joe, because you're told, oh, there's a shortage all across the world, so we don't have as much as we need. Cambry, that I mentioned, is supposed to be testing a lot of this, conducting a lot of these tests. And something I was told today was interesting to me, is because when you test someone once, you have to test them 2 more times after 14 days.
Yeah.
Yes. So let's say
even
you have
the people
about...
they release in hospital, they have to do the 3 and
confirmatory tests.
So if you have 6,000 test kits, it will only mean you can only test about 2,000 people. And then I was being told today that Cambry is expecting more tests. They say the more test kits. They're saying they're expecting by Friday this week, that's tomorrow, they'll have about 60,000 kits, half of them manual and the other half automated, which is actually pretty good news, because they're getting them from Roche, and there are some that are getting from Abbott, and there are some that the Ministry of Health is procuring from the Clinton Foundation. So it is well and good if we have these tests, and we should be using them. We need to be seeing more people tested every single day, so that we know the extent of the infections that we have. People are saying, in Mombasa, there were those who were saying they're not going to be tested. I mean, they don't even believe the disease is there, because they don't know any person who has it. And yes, we may have those who already had the virus, now akapona, now akaendelea mbele. That's why antibody tests are also important, to be able to tell us if someone already had the virus, na akapona, na akaenda. That's different. But now, this issue of testing is very, very important. So at least we know, yes, we do have this virus in many other places other than the ones where we've been doing the testing.
You know, I was talking to some friend of mine who's a doctor, and he seemed to be suggesting that there are conversations that go on in medical circles. I mean, just how long have we had this virus? Because, you know, there are countries, for example, in the US, where they discovered that as early as February, I think it was, someone died. And then now, in hindsight, they figured out and found that this person actually died from COVID-19 related ailments. So it is perfectly possible that when this thing broke out in Wuhan in December of 2019, that between December 2019 and March 13th, when our first case was discovered, were there people, for example, who came into Kenya when there was no travel restriction, the flights were still coming, that perhaps were positive, and maybe, you know, they got into communities. Some people got sick, got well, some died. We said, oh, we are mekufa pneumonia or whatever, and probably there were this. Because cases like that are now coming up in other countries, which is why I think this whole testing issue is so important. Not just testing for the virus, but even, as experts say, now beginning to figure out how widespread is this thing in the country. Because when it is so widespread, then the management also changes. It is not the same as when you are still trying to figure out, is it in this community or the other. It is possible that maybe it is everywhere in the country, that maybe the people who came earlier before we started taking note may have gone to all corners of Kenya, and that this thing may have people may have contracted it, got sick, recovered, and they didn't actually know what they were suffering from. The way we usually say, oh, ni homa tu hapa kidogo. So it seems that there is something more, that now we need to start asking other questions, because we can't just stick with the whole idea of testing and giving us all these numbers every day. I think there has to be a sense of movement. Like, where is this heading? Mm-hmm. What is the next step? It can't be, I mean, we could easily have the 29, whatever, for the next several months. Is that going to help? We need to now see, what is this thing, especially in light of what Dr. Mwangangi was saying today, that, you know what, this thing is now like malaria in Western Kenya, where it is ever present. It catches you today, you manage it, some people don't, but it is there, it's not going away. Linus.
And Advocate Catherine Muma says the movement that you're talking about should actually be in the direction of looking for more community-based solutions to stop the fire, because the problem is we are focusing a lot of energies on medical approach rather than the community approach that will deliver better results. She is talking about sensitizing communities so that you destigmatize corona, because when it comes to stigma, that is becoming a real problem right now. A lot of people don't want to be tested because of stigma.
Actually, a friend of mine was telling me yesterday, the father is a truck driver, and even at family level, there's that stigma. They don't want to associate with them, because there's this feeling now that truck drivers are the purveyors of the virus. See the stories that we've done, people in the border areas, they're having a problem living together with the truck drivers. And most of them are even having a problem accessing basic facilities, basic needs, like food, water. You go to buy basic commodities in a kiosk, and people are afraid of selling to you because they think huyu ni mtu wa malori na akona corona. And maybe these need to look at it a little more broadly. And number two, we keep talking about testing, because the danger or the enemy that we are dealing with is faceless. It's not something that you can say huyu anakaa kama akona corona or something like that. But if we're told by the government that it has the capacity to do 35,000 tests, or Kemri has the capacity to deal with 35,000 tests every day, and we have not even done a tenth of that every day, then it means we have a serious problem. And make no mistake, what we saw in Kawangware, what we saw in Old Town, what we saw in Isili, if you were to take that same approach, let's say to an affluent area like Westlands, for example, the numbers would still rise. So there's no estate, there's no region, there's no area that you can say, this is an area for corona and this is not an area for corona. So it requires a holistic approach. And the numbers that we keep getting every day during the daily news conference, you start realizing there's some sort of a fatigue. People are now asking, okay, so after kutupatia numbers, so people are yearning for a clearer solution. So this is the situation that we are in. This is what we are going to do. Otherwise, the daily numbers may not make a lot of sense to very many people. Yeah,
so we need to move on to the other matter of, we've seen a trend going on around the world where countries are kind of trying to open up certain things. There is that fear, you know, that there will be new infections. We've seen signs of that in South Korea, in China, and all that. But you see this appetite for moving on, like we can't be in this one place forever. And I think even the signal given by the CAS today that fine, yes, we need to be extremely careful, we need to make sure that we stop the virus from spreading rapidly in communities, but at the same time we have to come to terms with the fact that this thing is here for perhaps forever. She said for a long time, but that translation of that really is that it might not go away completely. So where do we go with this, Linus? I mean, it's a catch-22 in many respects, because there is a famous thing that I've heard Donald Trump say, which some people are beginning to say elsewhere as well, about comparing the cost of this and the eventual cost it might have on the economy, that governments are beginning to grapple with that fine, you can't allow people to just die, you know, get infected and die and whatever, but at the same time, when they come back, they need to have an economy to come back to.
Well, Joe, just in the same way we are not an expert panel on this coronavirus pandemic, this is the general trend across the world, because I think everybody's in this situation where it's new. You don't know how it will play out. There's a lot of trial and error. And trial and error is also happening in this so-called reopening of economies. And if you saw what happened in Germany, the moment they reopened and removed some of the restrictions, they started noticing the numbers of infections going up again. The same trend has been seen in South Korea. We've seen the same in Japan and also in China itself, where the return back to business formula is facing this challenge where suddenly new numbers are starting to come up. Now, coming to Kenya, I think we are finishing our 21 days, the next set of 21 days on Monday, I guess, is it? And very shortly, the National Security Council will be meeting, I believe under the chairmanship of the president, and they'll advise on what next. Would it be an extension? Would it be a continuation of restriction of movement? Now, here is one clear, predictable. CS for Education has already made it clear that it's not possible for schools to resume until at least June. What that will mean is if there are measures to be announced on Friday or on Monday, wherever the Security Council meets, then it means that at least we are sure that the schools bit will not, there'll be no movement in that. There are certain experiments that the government has put across, like reopening restaurants. We're yet to see how that is playing out. Is the government going to consider reopening other things that include churches and just basically complicate the situation further? My own feeling is it all depends on the trends with the infections. The infections are not going down. I think that should be really the communication that should go to the nation, that infections remain high. We are about to reach 1,000 people in terms of infections.
And Joe, we talk about infections remaining high, and we're not testing as much as we had promised we would. And if we did, chances are the numbers would go high. And now the worry about the socioeconomic burden of keeping citizens in the house is coming up, and how the economy is being affected. And we worry about whether it is safe. Like that's what countries around the world are grappling with, how safe it is to let people come out and start going about their businesses. I think in if it's Denmark, that children started going to school. You talked about Germany, that they had they're actually regarded as a model in Europe in terms of how they handled the response in coronavirus. They're warning now some areas may have to be closed again because after restrictions were lifted, they had more cases. In India and Russia, despite having infection rates going up every single day, they're also easing restrictions in some of those areas because of all these factors. The economy all across the world is being affected in a huge way because of people having to stay home, businesses having to shut down to try and curb the spread of the virus. In the US, the same thing. They're planning on opening up some states. And at the same time, they're still having infections every single day and deaths every single day. So it's, I think, it's a catch 50-50 situation where you want to save the economy, but at the same time you want to make sure that you reduce the rate of infection. And here in Kenya, personally, I'm worried about how we'd be able to cope, considering the fact that the government is still grappling with safe ways of opening up the restaurants after giving all those directives that people can start opening up restaurants. So for me, it's worrying. Even if we try and find ways of opening up the economy, but are we going to be able to manage the spread of infections? Are we going to be able to let people maintain social distancing? I saw an image on social media of a restaurant in the Netherlands where they've actually built a structure to keep two people within it when they're eating.
It's like a bubble.
Like a bubble.
And I think we need to go to